Welcome back to the deep dive. I'm so glad you could join us today because we are tackling a question that sits right at the intersection of workplace safety, women's health, and, well, some really outdated medical
Yes,
advice.
heavily outdated, yeah.
Right. We are looking at a highly searched and just completely misunderstood question, which is, can occupational lifting worsen vaginal looseness?
It's such a great topic because it is an area of health that has, historically just been governed by fear and old wives' tales, honestly.
Yeah.
Like for decades, women have been given this blanket advice to avoid heavy lifting to protect their pelvic organs. But as we're going to see from the clinical data today, that well-intentioned advice often completely backfires.
It really does. So to get you the actual ground truth on this, we've pulled together a massive stack of medical literature.
A very heavy stack.
Exactly, no pun intended.
Yeah.
We're synthesizing the UK's NICE guidelines, NHS physiotherapy manuals, some really extensive research on genitourinary syndrome of menopause, and of course, the latest biomechanical pelvic health studies.
Right. And just to establish the terminology you're going to hear us use, vaginal looseness is clinically referred to in all this literature as vaginal laxity.
Right, and it's a condition that's inextricably tied to pelvic organ prolapse, which is often abbreviated as POP.
Yeah, POP, and just broader pelvic floor dysfunction in general.
So our mission today is to separate the myths from the actual biomechanical science. That way you can make informed decisions, whether you're lifting boxes at work or picking up a toddler or hitting the gym.
Absolutely, because to really understand the impact of a heavy physical load on the vagina, we need to first, map out the architecture of the pelvis.
Yes, let's do the anatomy breakdown.
Right, so the foundation of this whole area is the pelvic floor. You can sort of visualize it as a muscular hammock or perhaps a dynamic mini trampoline that stretches right across the base of the pelvis.
And it attaches from the pubic bone at the front all the way to the tailbone at the back, right?
Exactly, that's the basic structure.
Okay, let's unpack this. Because that hammock have a massive, huge anatomical responsibility. It's physically holding up the bladder, the uterus, and the rectum.
It is. It's the primary support structure, keeping all those vital organs from descending.
But it's not a solid floor, right? It has to allow for the urethra, the vagina, and the anus to actually function.
Right. It's got openings.
So it's constantly managing tension, like tightening up to maintain continence, and then relaxing to allow for elimination or, penetration.
Yeah, and beyond just opening and closing those passages, that hammock acts as the primary shock absorber for your entire torso.
Oh, that's a good way to put it.
Yeah, whenever you move or jump, cough, or, lift something heavy, the pelvic floor is supposed to catch that downward force.
And this brings us to the historical medical consensus, right? Like why lifting was considered the ultimate enemy of a healthy pelvic floor.
Exactly. The fear is entirely rooted in something called intra-abdominal pressure.
I really want to focus on that pressure mechanic for a second. Because when you go to lift a heavy crate of supplies at work, your core muscles automatically engage to protect your spine.
Right, you instinctively brace your abdominals.
Yeah, but your abdomen is essentially like a sealed cylinder. You have your diaphragm at the top, the transverse abdominals wrapping around the sides, and then the pelvic floor at the bottom.
It's a closed system.
Right. So when you brace, you compress the cylinder, the diaphragm is pushing down, the abs are pulling in. So all of that internal pressure has literally only one escape route, which is straight down into the pelvic hammock.
And that's where the historical logic comes in. It dictated that if you increase that downward pressure frequently enough, you will inevitably stretch the hammock.
Which leads to vaginal laxity and prolapse.
Right. And we actually see this traditional view reflected in some global data. There's that Ethiopian study in our source stats.
Oh, yeah, the one with the really striking numbers.
Yeah. Researchers looked at women engaging in heavy physical labor, so carrying large loads of water or agricultural materials. And they found that women who carry heavy objects for 5 or more hours a day have more than double the risk of developing pelvic organ prolapse.
Double the risk compared to women who lift for an hour or less, right?
Yes. The specific odds ratio was 2.13.
Wow. See, if I'm looking at a study showing a 113% increase in prolapse risk from heavy repetitive lifting, the traditional medical advice to, never lift anything heavier than a bag of sugar seems like bulletproof logic.
It sounds perfectly reasonable on the surface.
Right. Like, if the pressure acts like a relentless piston pushing down on the pelvic organs hour after hour, why would any woman ever risk lifting heavy objects? Especially if she's already experiencing symptoms of looseness.
Well, that logical trap is precisely where the medical community stalled for years. It equates the mere presence of heavy weight with inevitable tissue damage.
But the newer data says something completely different.
Yes. What's fascinating here is a 2019 cross-sectional survey by a researcher named Forner. This study completely disrupted that old assumption.
I love this study.
It's great. Forner and her colleagues examined women who actively lift weights, and they specifically looked at the correlation between the amount of weight lifted and symptoms of pelvic organ prolapse.
And the findings were totally counterintuitive to the established dogma, Rob.
Completely backward from what you'd expect.
Yeah, the data showed that women who routinely lifted less than 15 kilograms were actually reporting more symptoms of pelvic floor dysfunction and prolapse than women who were routinely lifting heavier than 50 kilograms.
Which is a huge difference.
Here's where it gets really interesting.
Yeah.
50 kilograms is like over 110 pounds. How can loading 100 pounds of external weight onto your skeleton actually result in fewer symptoms of vaginal laxity than lifting a fraction of that amount?
It really highlights a fundamental misunderstanding of biomechanics. It is not the absolute physical weight of the object that causes vaginal laxity.
Okay, so what is the true variable then?
It's how the central nervous system and the musculature manage that intra-abdominal pressure we were talking about.
Oh, interesting.
Yeah, women who routinely lift heavy loads, like that 50-kilogram benchmark, have conditioned their entire core system to react efficiently. Their pelvic floor has actually developed an automatic, reflexive countercontraction.
So it's like an anticipation game. The woman lifting the 50-kilogram box has a nervous system that just knows a massive downward pressure spike is coming.
Exactly.
So the pelvic hammock instinctively braces upward to meet the load before the weight even leaves the floor. The force is neutralized.
Right, the system is prepared. But the woman lifting the lighter, say, 15-kilogram box, might not have that neuromuscular reflex trained at all.
She bends over, picks up the weight, the intra-abdominal pressure spikes, and it just slams down into a completely relaxed, unprepared hammock.
Yes, and over time, that unprotected downward force is what actually strains the connective tissue.
That makes so much sense.
Yeah.
And the physical therapy guidelines in our NHS sources are pretty adamant about this distinction, right?
Very adamant. Advising women to universally avoid lifting is actively detrimental to their health because the pelvic floor is a skeletal muscle.
Just like a bicep or a quad.
Exactly. Like any other muscle, it requires load to maintain its strength and its responsiveness.
And the protective benefits of lifting go way beyond just the pelvis, too. If a clinician tells a patient she must never lift anything heavy to, save her pelvic floor, they are effectively prescribing frailty.
That's a great way to phrase it, prescribing frailty.
Because that patient is being asked to sacrifice her overall muscle mass, her bone mineral density, and her cardiovascular capacity.
Right. In an effort to prevent vaginal laxity, we are pushing women toward a much higher risk of osteoporosis, metabolic syndrome, and just severe physical decline as they age.
It's an indefensible trade-off when you look at the big picture.
It really is. Which forces us to redirect our investigation entirely. If a heavy lift at work, when managed with a strong pelvic floor, isn't the primary enemy.
Then we have to identify what is actually degrading the structural integrity of these tissues in the first place.
Precisely. And the medical literature points overwhelmingly to two major life course events: intrapartum trauma from childbirth and the profound hormonal shifts associated with menopause.
Okay, let's look at the mechanical trauma first, because there's a really comprehensive prospective cohort study from Ireland that isolated the specific events during delivery that caused lasting damage to the hammock.
And we aren't just talking about the general weight of pregnancy here. We are talking about extreme, localized physics during birth.
Yeah. The Irish study focused on intrapartum risk factors, the conditions during the actual birth itself.
Right. They found that severe perineal tears, specifically grade 3 tears, which actually involve the anal sphincter muscle, drastically compromise the pelvic floor's architecture.
They also highlighted forceps deliveries, right? Which introduce this external mechanical force that can physically displace or stretch the anatomical space way beyond its natural elasticity.
Yes. And the study also flags a prolonged active second stage of labor.
The pushing phase.
Exactly. The active second stage is the pushing phase. And the researchers defined prolonged as pushing for more than 20 minutes.
Which, if we go back to our internal cylinder analogy, pushing during labor is the most extreme form of intra-abdominal pressure a human can possibly generate.
Oh, absolutely.
Applying that maximum unrelenting downward force against the pelvic hammock continuously for over 20 minutes is inevitably going to stretch the muscle fibers and ligaments.
It has to. The tissue can only take so much.
It's like taking a brand new rubber band and stretching it tightly around a large textbook for a week. When you finally take the textbook away, the rubber band just doesn't snap back to its original shape.
That's a perfect analogy. The structural integrity is permanently altered. It is functionally longer and looser.
Yeah, but mechanical stretching is a massive factor that only explains a portion of the population, right?
Right, because many women experience severe vaginal laxity and pelvic organ prolapse without ever having a vaginal delivery, or even after having uncomplicated cesarean sections.
So to understand why the hammock loses its snap in those cases, we have to examine the tissues at a microscopic level.
And this is where the sources from the British Society of Sexual Medicine and specialists focusing on genitourinary syndrome of menopause, or GSM, really provide the missing piece of the puzzle.
Yeah, GSM seems to be the invisible elephant in the room when we talk about vaginal looseness. We tend to think of the vagina and the pelvic floor merely as just muscles and skin,
But they are so much more complex than that. The entire lining of the vagina, the urethra, and the supporting connective tissues are incredibly dense with estrogen receptors.
which means they are completely reliant on a steady supply of estrogen to remain thick, elastic, and functional.
Exactly. If we connect this to the bigger picture, the cellular cascade that occurs when estrogen levels plummet, whether that's during perimenopause, menopause, or medically induced menopause, is honestly startling.
It really is. Like in a premenopausal environment that's rich in estrogen, the superficial epithelial cells that form the protective outer layer of the vaginal wall are robust and thick.
But when estrogen drops, those epithelial cells shed at an alarming rate. The mucosal layer can physically thin out to less than 10% of its former volume.
A 90% reduction in tissue thickness. That completely alters the structural reality of the vagina.
Completely. And it's not just a physical thinning either, it changes the entire localized microbiome.
Right, because those epithelial cells contain glycogen, and glycogen is the primary food source for lactobacilli.
Which are the beneficial bacteria that keep the vaginal environment slightly acidic, usually at a pH around 3.5 to 4.5.
So as the epithelial cells disappear, the glycogen disappears with them. The lactobacilli basically starve and die off, causing the vaginal pH to spike above 5.
Yes, and this makes the tissue incredibly vulnerable to infections and inflammation. But the most significant contributor to vaginal laxity actually happens deeper in the tissue layers, affecting the fibroblasts.
I love talking about fibroblasts. They're essentially the cellular factories responsible for synthesizing collagen and elastin, right?
Exactly. They build the scaffolding that makes your skin firm and your internal tissues stretchy.
But when the estrogen receptors are no longer being stimulated, these fibroblast factories just go completely dormant. They literally shut down production.
And without new collagen being produced, the existing collagen fibers begin to degrade. They sort of fuse together, becoming rigid and brittle instead of supple and elastic.
Wow. And the immediate consequence of this collagen depletion is the loss of vaginal rugae,
Right, the rugae.
which are those natural accordion-like folds lining the interior of the vagina that allow the tissue to expand during intercourse or childbirth and then naturally recoil.
Yeah, when you lose those accordion folds, the vaginal wall just flattens out. The tissue becomes pale, fragile, and rigid.
So when we discuss a woman in her late 40s or 50s experiencing vaginal laxity, we are not primarily talking about a muscle that got stretched out from lifting a heavy delivery box at work.
Not at all. We are looking at a fundamental systemic depletion of the tissue's structural proteins. The hammock hasn't just been stretched. The very ropes holding the hammock together have frayed.
That's such a stark image. Which brings us to the most critical part of our deep dive today, which is application.
Yes. What do we actually do about all this?
So what does this all mean if a listener's job requires physical labor? Say they work in healthcare moving patients or in logistics lifting crates.
Right. And they know their collagen production has decreased due to GSM, or maybe they have a history of a grade 3 perineal tear. How do they protect themselves?
Telling them to just quit their job or stop moving entirely isn't viable.
No, the clinical answer lies in mastering intra-abdominal pressure and engaging in targeted rehabilitation.
Okay, so practically speaking, you are standing in front of a 40-pound box you have to lift. The pelvic health physiotherapists in our stack point to one golden rule of biomechanics.
You have to stop using the Valsalva maneuver.
Yes. The Valsalva maneuver is when you take a deep breath, bear down, close your glottis, essentially locking your throat, and exert force.
We all do this instinctively when we try to, push a heavy piece of furniture, we just hold our breath.
But holding your breath while exerting force traps all that immense pressure inside the abdominal cylinder, forcing it violently downward onto the compromised vaginal tissues and pelvic floor.
Right. So the alternative is a technique often summarized as blow before you go. You must exhale through the effort.
As you bend down and begin the physical exertion of lifting the box, you actively blow air out of your mouth.
Yes, exhaling acts as a pressure release valve. By letting the air out, the diaphragm moves up, and the pressure in the cylinder escapes upward rather than bearing down on your pelvic organs.
It completely changes the physics of the lift. It's so simple, but so effective.
But, exhaling only mitigates the downward force. It doesn't rebuild the strength of the hammock itself.
Right. To do that, the NHS physiotherapy manuals detail specific pelvic floor muscle training, or PFMT.
The clinical guidelines suggest a really great visualization called the elevator technique to ensure the muscle is being trained effectively. Because many people perform pelvic floor exercises incorrectly.
Yeah, they just squeeze the general area without any intention.
Exactly. The elevator technique actually isolates the correct muscles. You start by imagining your pelvic floor as the doors of an elevator. First, you close the doors by tightening the muscles around the back passage.
Sort of similar to the sensation of trying to hold in wind.
Right. You establish the base tension at the back and then pull that sensation forward, engaging the muscles as if you were trying to stop the flow of urine.
Okay, so the elevator doors are closed and secured.
Then the lift begins. You visualize pulling those contracted muscles physically upward inside your pelvis. You draw the elevator up to the first floor, then the second floor, lifting towards your belly button.
And you hold that internal contraction for a few seconds, fighting gravity.
Yes. But the manuals emphasize that the most critical phase of this exercise is actually the descent.
Right, you can't just drop the elevator. Right. And you definitely can't leave it hovering on the second floor.
Exactly. You have to actively, consciously control the release, riding the elevator smoothly back down to the ground floor until you feel a complete absence of tension.
That full release is paramount. A healthy muscle must be able to move through its full range of motion.
If you continually contract the pelvic floor without fully relaxing it, which is a very common mistake, you develop hypertonicity.
The muscle becomes chronically tight and exhausted. And a tight muscle is functionally a weak muscle.
Yep.
If your pelvic hammock is permanently cramped, hovering at the first floor all day long, it has zero capacity to absorb shock. When you finally go to lift that heavy box at work, the muscle has no upward travel left.
It can't brace against the load, and the system fails. You need the ability to contract powerfully, but you equally need the ability to relax completely.
So combining that full-range muscle training with smart breathing mechanics basically transforms a heavy lift from a dangerous event into a strengthening one.
Exactly. Occupational lifting, when executed with an exhaling breath and a responsive pelvic floor, does not worsen vaginal looseness.
The load itself is not the problem. Poor pressure management, compounded by unaddressed hormonal changes and past mechanical trauma, is the true culprit.
And building overall physical strength is actually one of the most effective ways to support pelvic health.
We've covered a massive amount of ground today, and I feel like we've dismantled a very pervasive myth. You do not have to choose between a strong, capable body and a healthy pelvic floor.
No, you really don't.
By understanding these cellular realities of estrogen loss, acknowledging the structural impacts of childbirth, and just mastering your body's pressure valves through breathing, you can continue to live safely and live actively.
This whole investigation into the pelvic floor uncovers a much broader theme present in the GSM research.
Oh, what's that?
This raises an important question. The medical literature repeatedly emphasizes that pelvic floor dysfunction and the resulting changes in vaginal laxity profoundly diminish a woman's self-esteem and quality of life.
Yeah, that makes sense.
But the studies specifically note this psychological impact occurs regardless of whether a woman is currently sexually active. It really forces us to consider how much of our basic human confidence, our physical posture, and our sense of stability in the world is quietly dictated by this invisible foundation of muscles.
Wow.
It's a vital part of our anatomy that society has, for far too long, been too embarrassed to even acknowledge.